Welcome, Heather.
Thank you.
Let's just start by you telling us a little bit about yourself.
All right, so I met Dr. Teotia through a referral from actually a random friend I was working out with, and she had gone to Dr. Teotia, and I was looking to get a breast reduction. And her husband is an anesthesiologist, so I really trusted that as a referral, and actually checked up on you a little bit with other people, and a few other doctors who really recommended you, which made me feel really good. So I decided to make the big plunge, and I'd always told my breasts that I would like them to feed my children, and then I'd probably dispose of them, and that's what happened. So it was good. Good times.
And you were talking about working out. I know you're a very active person. Tell us about that.
Yeah, so I like to run. It's probably the easiest exercise for me to do, but I always was getting like rashes and such under my breasts, and so I was just really excited about being able to be more active without having to like duct tape down my breasts or seeing pictures of myself running. I finished the Chicago Marathon, and the first thing I looked at with the picture was like, oh my gosh, it looks like my boobs crossed the finish line like 5 minutes before I did. So I was looking forward to having like regular size breasts, and was kind of a little bit nervous about getting anything done about it, but also kind of thrilled to be able to just feel a little bit more normal.
Okay. And we ended up doing a little bit more.
Yes, we took a little bit more of the plunge, yes.
So did you decide just to go for it all because you were...
I did. I'd lost some weight, and so I was pregnant a little bit later in life, so my skin kind of didn't bounce back. I had 2 babies within 16 months, so I had a little bit of skin that was, my stomach wasn't quite so cute, so I decided to just go ahead and do the tummy tuck with the breast reduction. And I will say, like, plastic surgery, I've never even done Botox, which is weird for a Dallas person. So I've never done Botox, never done injectables. I mean, the most I've ever done is like a photo facial. So this was a big, like, mental step for me. I felt like saying that I was having plastic surgery seemed really, like, crazy. Out there, very out there. Like, I felt guilty about it. But I can say after the procedure, I mean, it's life-changing. I feel so much better. I'm just 2 weeks out, but I feel just so much better. My clothes fit better. I have shirts that I can wear now that I've never been able to wear. I can't wait to be recovered so I can actually go running again. Yeah.
And it's perfect that you're 2 weeks out, because often this is sort of like pregnancy. You're 6 months down the line. You've sort of forgotten what you used to look like.
Right.
Life has adjusted. So tell me more about the process.
So the surgery was fine. I mean, the pre-surgery part was okay. I did read all the instructions before, and I made sure that I was ready for it. Woke up from the surgery, felt fine, and I mean, it's not been the easiest recovery, but it's not the worst, and it's kind of, I keep telling my husband, I said, I don't know if it was worth it. And he always looks at me and he's like, you are going to love this. You look great. You've gotten rid of excess. He's like, I can already tell that you feel better in your clothes. And I keep telling myself that the recovery will get better. I mean, it gets better every day, but, just being 2 weeks in, it's like having a kid. It's like you can't remember what your body felt like before, but
yes.
Eventually you'll get used to your new body.
Yes.
Yeah.
And what's been the biggest surprise?
I think just the feeling of just clothes fitting better, feeling like, especially, like laying on your back and just feeling like you can breathe easier and your back feels better. That's been probably definitely the best part.
Okay. And how many pounds down are you? People like to know.
Yeah, so I was shocked that when I got on the scale after surgery, like 2 days later, I was like 15 pounds down, which is shocking because I thought it was gonna be like a few pounds, but it's nice. And also I needed to get rid of belly fat because it's so bad for you, just in general. And so now I don't have as much belly fat, and it's, I think it's way better health-wise for your heart and all that good stuff.
Okay. And have you told people or not? People are different about this.
So I generally tell people everything in my life, which is not always the best, but I feel like I kind of cheated weight loss. So I have a hard time not telling people. So I told pretty much everybody that I'd met, from the people checking me out in the grocery store to anybody, that I was having a breast reduction. I didn't say anything else, but it's somewhat obvious. Although I had lost like 25 pounds before the surgery, which was nice. So people had noticed I had lost weight. But I don't know. It's like when someone asks me, you know, oh, it looks like you've lost weight, instead of just saying thank you, as my husband says, you can just say thank you. I'm always like, oh, well, I had this and this. So I don't know, I'm still working on putting a little bit of a filter on me. I don't know. But definitely my good friends, I have told, and they're all like completely, they think I look fantastic, which has been really nice. Because losing the 25 pounds, I lost the weight, but I still had so much kind of excess skin. So it was like, it looked okay, but it was kind of still like looked not quite as, good as it could have been.
Yes.
Yeah.
Okay, so tell us about the build up to surgery.
Right. So I came in for a consultation. I met with other plastic surgeons. So just in all sense of disclosure, I did meet other plastic surgeons, but I felt like with your staff, it was very like welcoming, and there are people on your staff that have had the same type of surgery. They were willing to answer any question if I called up here at any time. And also for me with the breast reduction, I had insurance pay for it. So they helped me with all that, which was huge. Obviously when insurance pays for it, it saves tons of money. And they were fantastic with helping me with that process, and very communicative on how to get through it. And then also when I came in, it's like everybody really did look at you and ask you how you were, like, in your well-being, not just like, oh, hey, how are you coming in for an appointment, but very much like they cared, and they, like I said, would answer any question at any time if I called up to the office, which was fantastic. Especially with an elective surgery. I mean, because you kind of feel guilty, like I'm choosing to do this to myself, but they were all very caring and like, you're going to feel better and you're going to do this, and this worked for me, or this didn't work, or we've had patients that have told us this is great and this isn't. So it was really nice.
Okay. That's nice to hear.
Yeah.
I have great staff. I'm very appreciative.
Yes.
You mentioned that you sort of are willing to speak freely about most of this. So the random person asks you about this. What do you say? Do it, don't do it?
I would say definitely do it. I mean, like I said, I'm 2 weeks into probably a 6-week recovery. And it's not the easiest, but I think in the long run, it is definitely worth it. It's better. Actually, one of my doctors said it's better for your health to get rid of the fat around your midsections. And like I said, I feel like I cheated weight loss, but I will take it because it is better for me in the long run. And I feel better, and I feel more comfortable in my clothes. Like I said, I can't wait to go running again and go walking. But even just, like randomly, like cooking and playing with my kids has been, even just 2 weeks out, has been way easier. I think for me, it was a guilt thing. I feel like I feel somewhat guilty, and it feels weird to say I've had plastic surgery. But I think when it comes to making you a healthier person and getting some of the fat off your body and the excess skin, I think it's something that I would definitely say yes to.